Welcome to the Greenbridge Minute, brought to you by Greenbridge Society and Greenbridge Health. My name is Dr. Gerald Knipp. Anxiety disorders are the most common mental illness in the United States, affecting 40 million adults every year. Cannabis has been used to alleviate stress and anxiety for thousands of years. One of the earliest mentions of cannabis has been found in the Vedas, which are sacred Hindu texts that may have been compiled as early as 2000 to 1400 BCE. These ancient texts call cannabis a source of happiness, joy giver, and liberator. Today, as cannabis becomes legal in more states, it is being used quite frequently to alleviate anxiety symptoms. The three most frequently reported reasons for using medical cannabis are managing pain, anxiety, and depression. Over 58% of medical cannabis patients report using it to manage anxiety. In a Canadian study following nearly 1,400 patients using the StrainPrint app, anxiety was reduced to 93.5% of tracked cannabis sessions. Let's look closer at the chemical composition of cannabis and how it can reduce anxiety. Cannabis contains chemicals called cannabinoids that interact with the human body's natural endocannabinoid system. THC, or tetrahydrocannabinol, is one of the two major cannabinoids. THC has a biphasic effect when it comes to anxiety. Low doses of THC reduce anxiety, but higher doses are ineffective or may even cause anxiety. Nabilone, a synthetic THC drug, has been studied in patients with anxiety and PTSD. One study suggested the low dose of 3 milligrams daily may be optimal for reducing anxiety symptoms. Cannabidiol, or CBD, is the other major cannabinoid. In 2015, Esther Blessing and colleagues reviewed 49 preclinical studies. They found that existing preclinical evidence strongly supports CBD as a treatment for generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive compulsive disorder, and PTSD. In one placebo-controlled study, 24 patients with generalized social anxiety disorder were given 600 milligrams of CBD before a simulated public speaking test. The treated patients had significantly reduced anxiety and discomfort in speech performance. In general, low to moderate amounts of CBD seem to significantly reduce anxiety symptoms. Since both CBD and THC can reduce anxiety symptoms, we commonly recommend products containing both cannabinoids. An additional benefit of this combination is that CBD reduces some of the side effects associated with THC. CBD has actually been shown to counteract the anxiety caused by higher levels of THC. Many of the anxiety patients we have seen have responded very well to cannabis products containing both THC and CBD. In addition to THC and CBD, over 130 minor cannabinoids have been identified, and several have shown promise in reducing anxiety symptoms. CBG is just one example. Several animal studies have reported on CBG's ability to reduce anxiety symptoms, and we regularly see anecdotal evidence supporting CBG's use in anxiety patients. Another class of chemicals found in cannabis are the terpenes. Terpenes are like the essential oils of cannabis. They contribute to the flavor and aroma of cannabis, and some terpenes do provide medical benefits. Several of these terpenes seem to help reduce anxiety symptoms. Limonene, commonly also found in citrus fruits, has demonstrated anti-anxiety effects in animals by increasing serotonin in the prefrontal cortex and dopamine in the hippocampus. Beta-caryophyllene, another terpene, displayed anti-anxiety and antidepressant effects in several animal studies. Beta-caryophyllene interacts directly with the endocannabinoid system, which seems to play a role in treating anxiety and depression. Other terpenes such as linalool, pinene, myrcene, and terpinolene most likely contribute to the anxiety-reducing effects of cannabis too. Every patient is unique, so at Greenbridge Health, we help each patient find the best cannabis regimen for them through one-on-one consultations. However, we do see some general trends with patients suffering with anxiety. Most anxiety patients respond well to longer-acting dosage forms, such as tinctures and capsules, that contain a low dose of THC and a low to moderate dose of CBD. Due to the time needed to reach steady state with CBD and the regulation of certain receptors in the brain, we tend to see better results after 2 to 3 weeks of daily doses. It's always recommended to start at a low dose and increase slowly. For treating the acute symptoms of anxiety, inhaled products can provide quick relief. Due to their fast onset and higher potency, it is important to find inhaled products with a chemical composition that is most likely to produce an anti-anxiety effect. Inhaled products with higher concentrations of CBD and CBG will provide more anxiety relief while helping to cushion the side effects of THC. Also, it is important to check the terpene content of the inhaled products to maximize the benefits of the entourage effect. Due to finding an effective cannabis regimen, many of our patients are able to reduce their use of prescription medications. Commonly, anxiety patients are able to eliminate their use of benzodiazepines in 2 to 3 weeks. And after 1 to 2 months of a medical cannabis regimen, many patients are able to wean off their SSRI medications. Similar effects were seen in Italy, where the availability of low THC cannabis led to the reduction in prescription medications. The most dramatic decrease was seen in prescriptions to treat anxiety, and a 2019 study demonstrated a reduction in benzodiazepines in patients prescribed medical cannabis. After just 3 courses of medical cannabis, 45% of patients had discontinued their benzodiazepine use. At Greenbridge Health, we commonly recommend non-pharmacological measures for anxiety patients too, such as meditation, mindfulness exercises, and counseling, all to be used in conjunction with medical cannabis. If you would like to schedule a medical cannabis consultation, please go to our website, greenbridgehealth.com, and make an appointment to meet with one of our experienced medical professionals. We look forward to helping guide you on your cannabis journey back to health.